Today we're here for our first webinar, Optimization of the Individual Performance in Golf with Dr. Dave Mishra. As a icebreaker, let's just have everyone put in the chat their favorite golf course they've played at recently.
Can I just say it since I'm not
Sure, yeah, you
in
can
the
say
chat?
it.
Yeah?
Yeah.
Can I start it off that way?
Sure.
Sheep Ranch at Bandon Dunes.
All right. When did you play that, Dave?
So that was about a year ago. So it wasn't the most recent thing, but it's still so memorable. I mean, all the courses at Bandon are phenomenal, but Sheep Ranch was just really cool. It was really cool.
That's super fun. Yeah.
Recently for me is Coyote Moon up in Truckee.
Okay.
Oh yeah, that's beautiful. Yeah, it was a while ago, but I feel like the best golf experience I had was at like a really laid back course in Kauai. I think it was like $10 for a round of golf, and but you're on the ocean, beautiful place. Everyone's really relaxed, so it's hard to beat that.
Awesome.
If anybody in the chat put down Augusta National, we're all going to become friends with that person really quickly.
Right.
Yeah? Okay.
All right. Well, that's great. My name is Johnson Chu. I'll just get started. I'm a physical therapist and athletic trainer. I am a practicing clinician at the San Mateo Agile site and also the San Carlos Sutter Health. I'm a Titleist Performance Institute Level 1 certified trainer, and also I'm originally from the East Coast. Next, I'll have Wes introduce himself.
My name's Wes. I'm a physical therapist and board certified orthopedic clinical specialist. I practice out at San Mateo Agile as well as PAMF Palo Alto.
Well,
Yeah.
Ryan.
Yeah, my name is Ryan Benoit. I'm a physical therapist at the Sunnyvale Sutter Clinic. I completed my physical therapy orthopedic residency and fellowship training here at Agile. And then now I'm on faculty for the fellowship where I teach the movement analysis of golf and how to treat a golf patient. So that's the course I teach.
And I'm Dave Mishra. I'm an orthopedic surgeon and sports medicine specialist. This is my 29th year in practice. My orthopedic credentials are from 93 to 2003. I was the team orthopedist at Cal Berkeley, did the Oakland A's when they were a reasonable ball club from 2000 to 04, US soccer for about 25 years. And on the golf side, I'm TPI medical certified level 2. And for the past 3 years, I've been focusing on non-surgical therapies, principally injection type biologic therapies. And I am seeing patients at the Agile San Mateo and Agile Palo Alto offices.
Thank you, Dr. Mishra. So we'll just get started with a few questions. So first, what factors influence the optimization of an individual's performance in golf?
So great question. And I think one of the amazing things about golf, as compared to so many other sports, is the phenomenal number of inputs that you can put into this thing. And so depending upon how deep a dive a person wants to take into optimization, it could encompass any number of different things. But having said that, I think for most amateurs, at least in my experience, when they come to see me in the office, they've already been injured, right? So that's one of the reasons why they're coming to see an orthopedic surgeon. And for most amateurs, they talk to me about performance can mean just hanging out with your friends and having a good time. It can mean beating your friends. It can mean better scoring on the course to lower your index. It can mean staying healthy and injury-free to enjoy golf well into your 90s. And it can increasingly these days mean for a lot of folks hitting the ball farther. For a pro golfer or for a tournament level amateur, there's going to be a number of other factors that are also involved in there. And for those golfers, it principally comes down to performance optimization means doing whatever you need to do to win. So regardless of your objectives, I think that the tools that you have at your disposal for performance optimization largely fall into 3 buckets. And This is actually something that it's not my idea. It's an idea that came to me from Mo Pickens, who's a mental performance coach who's out at Sea Island in Georgia. And he talks about off course being one bucket, practice and prep being another bucket, and on course being the third bucket. And so off course is kind of where we are going to focus most of our efforts during this talk here. So off course would include your physical health. So if you are somebody who comes in with some sort of a ding or an impairment, low back, hips, shoulders, something like that, then we're going to talk about making sure that you take the proper pathway to get that part of you physically as good as you can first. If you come in and you're already an elite level athlete that's performing at a very high level, physical optimization is still super important, but it can take a different set of forms. And then also included in the off course would be things like nutrition, sleep, hydration, and just management of general life events. The second bucket, practice and prep, we probably won't touch upon that too much during this talk, but one of the key areas for amateur golfers is actually how you conduct your range session. One of the main sources of injury amongst amateur golfers is hitting too many golf balls off of firm mats at a driving range. And so if you learn how to structure your practice session for what a lot of the instructors call shot allocation, figuring out which shots are the most important for you to score in your round, and then focusing on those shots when you're on the practice range, that's a big thing. Second, making your practice time more efficient by not just banging out balls, but you hit 10 and then you hit to 5 targets. So try to gamify the experience a little bit to start recreating what you may expect on the course. Short game putting, using your swing coach or instructor. So that's the second bucket, which we practice and prep for optimization. The third, on course, we're not going to touch upon that really at all, but that's the mindset that you bring to the course. That is your pre-shot routine, strategy, and then nutrition and hydration will play roles in there as well. But I think for us today, kind of focusing on the physical aspects of off-course preparation is probably where we're going to find the best opportunities for optimization.
Awesome. Thank you for that. We'll move to the next question of what is your philosophy on the team-based approach to optimization of an individual?
Yeah, here again, I think that it's not surprising when you kind of look at the way that professional sports in general have gone, where so many of the athletes, especially the super elite professionals, have an entire team around them, not just their swing coach anymore, but many, many people. And in general, I'm a huge believer in this team-based approach to performance optimization. And we're going to talk a little bit about, for amateur golfers, how a physical therapist, an athletic trainer, and the swing coach can work together with medical professionals to optimize. But for the professional, if you look at who's on Rory's team, I mean, he's got a swing coach for his full swing. He also has a short game coach. He has a putting coach, a mental or sports psychologist, physiotherapist, massage therapist, a chiropractor, a nutritionist, data specialists, hugely important. Everybody's seen Rory is a big proponent of the Whoop, which is providing him metrics on heart rate variability, his heart rate, sleeping metrics. All of that is part of the professional's toolkit now. And then, of course, they've got their equipment rep. We were joking around just a minute ago as one of the best ways to optimize your performance is to probably go buy a new driver. So an equipment rep, a huge part of performance optimization for the professional as well as for the amateur. But on the recreational or amateur side of things, most amateur golfers are not going to have access to that large team of people around them, and instead are either going to be going it alone, maybe some YouTube videos, occasional lessons with a hitting instructor or a swing coach. Probably a lot of folks, at least here on the peninsula, are going to be using personal trainers. And then, of course, if you've had an injury or an ongoing condition and you're here at this Agile webinar tonight because you're working with amazing physiotherapists at Agile. So that's going to be kind of part of your performance optimization team as an amateur. So the team approach, I think, becomes super important for the amateur golfer in certain settings. So setting number one is that if you've got an event or a competition coming up, if you've got a club event, if you've got a tournament or something like that, and you want to try and optimize or periodize to get peak performance that's happening during that competition, that's where this group of people can be really, really helpful. And then some other obvious or maybe not so obvious areas, if you've got an acute injury, again, you're coming to Agile Physical Therapy to manage that acute injury. That's a perfect time to be talking with the physiotherapist to help optimize the things that you can, and so that when you're recovered, you're hitting the ground running. The other area I think is managing ongoing or chronic conditions. Again, we're going to touch upon that a little bit more in a little bit here, but a tremendous opportunity to use a multidisciplinary team around you to optimize what you're doing on the golf course. And then the final thing I would say is, as a golfer moves into senior years, having a group of people around you, such as a skilled physiotherapist, is going to be tremendously beneficial, not just for optimization, but also for injury risk reduction. So I think pros have one thing, amateurs have another, but both have real needs for team-based performance optimization.
That smoothly transitions us to our next question. So what are some of the barriers to optimization of performance in golfers?
Yeah, I think that, well, one of the barriers we just kind of touched upon there, Johnson, which was that a lot of amateurs just don't have access to that vast array of people around you. But one of the other barriers is just not having the knowledge to know that resources are in fact available to you. You're going to talk, I think, in a little while here about the background behind the Agile Golf Program. It's going to be a phenomenal resource for golfers who may not have such a resource existing for them already. So I think that's the second thing, is just a lack of knowledge that this resource exists for them. The other barriers, I think, are more, I would say, structural, which is that we all have busy lives and not everybody can be like a professional athlete where you devote hours and hours upon day after day to do what you need to do because that's your job. And so for the rest of us who have family lives and work obligations, you've got to try and maximize what you're doing to get the best benefit for the shortest amount of time. You know, that's kind of what I was talking about with the range session optimizations. If you've only got an hour once or twice a week, then you want to make that a really good hour. And the same thing goes true for your physical training. You want to make sure that you identify the areas that are going to be most beneficial for you to achieve peak performance in golf.
That was a lot of great information, and I feel that we can all take that information and improve our golf game. Specifically, since we have you here, our last question would be, what are some common situations for use of biologic therapies in golf athletes, since this is a specialty of yours?
I do want to, actually, if you could kind of between the last slide and this one, Johnson, yeah, this one doesn't have a slide, but actually it's something that I think is a huge part of my orthopedic practice, which is going to lead us into the last question there. But one of the areas, actually the key area where I see amateur golfers get into trouble is in what I would call the unintelligent application of speed training. So if we could take just a minute to talk about that, I think the current thinking amongst the golf guru instructors, a lot of this comes out, if anybody's on this webinar that's heard of a fellow called Mark Brody. He's a statistician golfer who's given us a lot of the terminology used today in terms of things called strokes gained. You've probably seen those on the tour telecasts, but basically out of Brody's work has come this idea that regardless of your level, if you're an elite professional or if you're a 30 handicap, the farther you hit the ball from tee to green, not just your driver, but the farther you hit the ball from tee to green, the better chance you have at scoring lower. So that might be a statistical fact, We can debate that a little bit too. But what happens from a physical and orthopedic standpoint is that in order to gain distance, one of the most effective ways to do that is to gain club head speed. And to gain club head speed, a lot of folks are going to start engaging in activities or behaviors that their body might not be ready for. And so you can think about a concept called overspeed training that's done with speed sticks or rip sticks, stack system, which by the way, I love. But the point being is that you may engage in training that your body's not ready to do, and that is a perfect way to create an injury or pain. And when you create an injury or pain, you have the potential to be out for a long period of time, and that's going to negate whatever you were trying to do in the training in the first place. So I think that especially if you're coming at speed training with a pre-existing injury, this is where the collaborative team approach is going to be massively helpful for you. And I want to credit here Terry Rolls, who's an amazing golf instructor and uses kind of an automobile analogy when he talks about the proper foundations for building speed. So he talks about first thing you want to do is build the engine, which he refers to as creating the foundation in your body. So if you have a pre-existing condition, such as you've got a chronic low back condition, you've got a disc problem, facet arthropathy, foraminal stenosis, and I know those are technical, but for the folks on this call, if you happen to have one of those things, you're going to know what I'm talking about. If you have that, if you've got rotator cuff issues, if you've got elbow tendinopathies, hip arthritis, labrum issues, trochanteric bursitis, knee arthritis, if you have any of these things, and you then embark upon speed training, it's a real setup for something bad happening. So Terry's idea, build the engine first. So before you embark upon speed training, make sure that you get those things properly optimized. If you work with a good physiotherapist, such as what we have here for our access at Agile, they're going to be able to identify for you through objective analysis and measurements. Here are the areas where you're strong. Here are the areas where you've got some opportunities for improvement. We're going to optimize these areas first to make sure that you're in the perfect position to set yourself up for success when you start speed training. So number one, build your engine. Number two, Terry likes to talk about if you are in an automobile then and you press the accelerator and the brake at the same time, nothing really good is going to happen from that. So he likes to talk about taking the brakes off as the second step, which is to say that you work with your swing coach to get as free-flowing a swing as possible. We're not going to have a time to discuss this on today's webinar, but the biggest problems happen, in my opinion, through deceleration in the upper extremities, which is that if you are hitting too many balls off of a mat, you're going to decel every time that you get into that, and you're just going to set yourself up for shoulder or elbow problems. If you hit a tree root, you're going to decel very rapidly. So Terry wants you to start developing a more free-flowing swing, which you can do with the help of your instructor, and to try and make that swing the best possible for the body that you have. And then the third step is once you've gotten those things, you've got your physical setup, and then you've got your swing with your grip stance and alignment and the way that your swing looks, then you can start working on speed training. So speed training for most golfers happens during the wet or winter months, depending upon where you live. So December, January, February, those are the 3 months that people work on speed training. So between now and December 1, get yourself lined up, and I think you'll be in a much better place. So sorry, Johnson, I had to back up a little bit.
That's all right. That I think that's really important to discuss those barriers and how to optimize yourself. If we need those situations, though, where our engine needs a little extra, I think that leads us to our next situation, where one are common situations for patients to use biologics, specifically for golf.
Yeah, sure. So I think if we kind of go back to some of the things that I just mentioned there, soft tissue conditions in particular, and I'll name them in a moment here, are really helpful um, to get treatment with a good physiotherapist first off. I think usually most orthopedists will, unless there's something torn and detached that obviously needs an operation, most physiotherapists are going to be involved as a first phase. And then second phase, we may move into injection therapies, which I'll expand upon in a minute. But the area that I've found that is just super beneficial is the lead knee. I'm going to dig down pretty deep here. The lead knee that has moderate osteoarthritis. And so the left knee of a right-handed golfer, the right knee of a left-handed golfer is an area that is vulnerable to stress that happens usually on rapidly extending the knee as you go into your through swing. And this is a problem area, is that if your lead knee is bothersome, it's really hard to kind of modify things in play. You can do a few things with flaring your feet out and trying to lift your left foot, trying to lift your right foot at various points in the swing. But fundamentally, if that knee hurts, it just hurts. And over the last, I would say, 3 years, we've gathered a really large amount of independently produced and highly validated scientific studies that have shown superiority of a particular biologic called platelet-rich plasma compared to the old injections called joint lubricants, hyaluronic acids. It used to be that hyaluronic acids were the thing that we would have to do. That has largely been supplanted by PRP. So I would say, Johnson, that one of the best use case areas for biologics in golf athletes is moderate osteoarthritis in the knee. It can be just hugely helpful there. Interestingly, it hasn't worked as well for arthritis in the hip or in the ankle. But one area in the hip where it's worked, again, tremendously well is a condition called bursitis or trochanteric tendonitis. And so a soft tissue condition that happens on the outside of the hips from too much sway or too much slide in your swing, that can be something that gets really nicely helped by PRP. Cortisone has been the standard of care for that type of condition as far as the injection, but the biologic PRP is really doing much better than cortisone. In the elbow, interestingly enough, PRP in the elbow was one of the first use case indications. It's probably been around for about 12 to 15 years and actually was pioneered by Alan Mishra in Menlo Park. And it hasn't, for whatever reason, I'm not sure if it's the biology or the blood flow or something, or just that we're not fully understanding what the right person is for that. But the PRP injection hasn't worked quite as well in the elbow, even though we have been studying it in the elbow for a really, really long time. Nevertheless, I think it's a viable therapy because it's super safe, and under the right conditions, that can be something to consider. And then in the shoulder, if rotator cuff tendonitis hasn't properly responded to physical therapy, usually the orthopedic surgeon's going to do a cortisone injection as a next step. Again, I think it's up to debate as to whether that actually should be the first injection performed, but most orthopedic surgeons will still perform a cortisone injection as the first step, and then we would go to PRP generally as the second step. I've found PRP to be hugely helpful for rotator cuff tendonitis. It gets a little bit, we're probably getting into a little bit more detail than we should on this, but the rotator cuff has a thickness, and the more thickness that it has, the more that it looks like a normal rotator cuff on an MRI or ultrasound, the better are your outcomes. If it starts getting thin, like with a partial tear, then the outcomes are not quite as predictable, but still, it's likely a better outcome from PRP than going to an operation where that partial tear is going to be converted into something called a complete tear, and then we repair it. I think I just gave you way more detail than you wanted, but those, I think, would be the top situations for biologics in the golf athlete. Knee osteoarthritis, definitely. Hip tendonitis, definitely. Rotator cuff in the shoulder, definitely. Elbow tendonitis, probably. and hip arthritis, probably not.
Thank you for all
And back, I didn't deal with back. I don't see
we'll do
backs in
back
my
next time.
yeah, I don't see backs in my practice, but I'm not really aware of. I know that PRP is being done in the back, but I'm just not aware of the outcomes in the clinical literature to be able to advise too much on that.
Hmm. I think that the information you provided is super helpful for a lot of our patients. Again, we could definitely dive into the specifics of a lot of those things in the future. Thank you, Dr. Mishra, for all the information. We just want to check out the chat. Ryan, did you have any questions that you found?
Yeah, I've got one to start us off. So how much does an amateur golfer need to work on mobility and flexibility training versus strength training?
Does Ryan or Wes want to take that?
Yeah, I can give my perspective and things, but why don't we? That's probably much more along your line of expertise there. So I'll defer to you guys first, and then I'll offer a perspective there.
Yeah, I think like Dave was saying, like there's a million great exercises out there to do online, and you can always find that. But we're not professional athletes, and we don't have time to do all of these. We have jobs and other things. So I think an important piece is to know what you do need to work on. So going through like a screen or something like that is helpful. So that you can identify I'm tight here or I'm weak there, and so you know what to work on. But I think general mobility. Golf is a rotational sport, so having a lot of working on like thoracic mobility is often an area that people are stiff. We're driving and typing all day long, so that's generally an area where working on rotation mobility is really helpful. And then strength training. Like Dave was saying too, to build that engine bigger can help prevent you from getting injured. If you're generally strong in with weight training, that helps really prevent injury in other areas, including golf. So it's kind of my thoughts. Do you guys have anything else to add?
I would say that I completely agree in terms of thoracic mobility, Ryan. I think that as a golfer gets older, one of the areas in general that tends to get neglected in our overall health and well-being is strength. And I think that for a lot of folks, not just golfers, but any folks in general, they tend to underemphasize strength kind of beyond the age 50. And so I think that the thoracic mobility that you mentioned, Ryan, is hugely important for the golfer. The other areas I think is pelvic stability and flexibility. And then the other area would be lower extremity power. Each of these things is going to help contribute to a more efficient backswing. The thoracic mobility is going to help you with a bigger turn, and that bigger turn is going to lead to better performance. And it also helps to reduce stress on your low back. The pelvic stability and flexibility is also hugely important in preventing low back pain or reducing low back pain if you're unfortunately already experiencing it. And then for the lower extremities, there's a concept called ground reaction force, which is part of the addition of speed or adding gas that you would do after you've built your foundation. And so the lower extremity power, I think, is something that could probably give you a few extra yards as long as you learn how to train for that properly.
And I think when we look at golfers or patients in our practice, when we look at the body, we also think of it as areas of mobility and areas of stability. And so when we go through an assessment, it's important to figure out what areas do we maybe need to get more mobile and what areas do we need to stabilize, or has there been any shift in those things? And that's where we'll sometimes see issues with pain, injury, or decrease in performance.
Great. Ryan, was there any other questions or do we feel good to wrap up?
We got one other one. The person asked, "Can I golf after joint replacement? And what factors do I need to consider?"
Yes, you can. And so let's kind of talk about the three most common joint replacements. And so for hips, absolutely. The hip replacements, I think, are going to have some restrictions depending upon whether your surgeon has done an anterior or a posterior approach. And so if you have a posterior approach, you're probably going to be asked to wait longer before you take any swings. But at the end of the day, if you kind of look down 4 to 6 months down the line, you should be able to golf after hip replacement. It's a very reasonable expectation. Knee replacements, similarly, it's going to take you a little bit longer to get back on the course if it's the lead knee versus the trail knee. Trail knees always get back, in my experience, about 6 weeks sooner than the lead knee. But yes, you can definitely do it. Shoulders, the same thing. If you get a shoulder replacement, it's a very reasonable expectation that you should be able to get back on the golf course and play.
Ryan or Wes, did you want to add anything to that?
No, I think if there's no other questions, I think we all just want to thank everyone who joined us today. We do look forward to you joining our next webinar that we offer. And again, this is all recorded and will be sent out to anyone that registered. We will be having in-person performance visits with limited availability that are going to be coming forward in the next few months. What we're looking to build is we're looking to build a 12-week program where we go through an initial assessment where we're taking shot data collection. We're doing a 3D swing analysis, a functional objective assessment. We're offering a consultation with Dr. Mishra, our orthopedic surgeon, and looking to develop a personalized, tailored program to optimize your individual performance. So if anyone is interested, please reach out. We do have Dr. Mishra and Johnson's email available. If anyone's interested in being reached out to regarding when this is going to be offered, I would say please reach out to Johnson at agilept.com, and we will be looking to give more information in the coming months.
Thank you, Wes, and thank you, everyone else. And everyone have a great night.
Yeah.
Thank you, everyone.
Thanks, Dave.
Bye, everyone.